Hey, welcome to the Go to Physio Lumbar Series Part 5. Now, in today's episode, it's going to be a very important content that you are going to use when your worst nightmare happens in the clinic. And that is when a patient just either locks up or they come in and they're bent over, they can barely move. You're like, right, well, I can't really assess you. What do I do? Well, hands down, what you can do to give massive value to your patients is help them get up and down off the floor, okay, during this acute period. So this is so important to do. I had one of my mentorship therapists ring me about 3-4 weeks ago and says, Dave, is there any chance you could do a FaceTime with this patient? She's pregnant, she's stuck on the floor. Okay, she's been on the floor for 4 or 5 hours. Okay, I'll be honest with you, I wouldn't even know where to start with the patient. Even though this content was in the mentorship members area, he didn't have the confidence to do it. Okay, and that's something I'm going to look at with me and with my teaching. But what I did is I literally did what I'm going to show you in this content now. We had the lady up within 20 minutes max. Okay, I was off the phone, she was up, she was moving around, reassured, a lot more confidence. All we did, now it only took 5 minutes to literally get her up. We integrated what I'm going to show you. We integrated the previous lessons here. It's so powerful. It's so important. You need to understand this, and it's very empowering for the patient. So with that said, let's get straight into it. I'll see you on the other side. Okay, so at some point you might have an athlete who comes in and they're going to say my back went or whatever. So usually the scenario in sport is they've been in the gym, they're lifting weights, usually something like a bent over row or something like that, or some kind of Olympic lift. They maybe didn't do it maybe efficiently, and they get a lot of protective spasm, and they come in bent over, they can barely move. Okay, you probably see these patients, you'll see a lot of these people like in the clinic. So one of the best things that we can do for this athlete is we can help that athlete to move pain-free again. So again, every movement at the moment, the system's on high alert. Every movement is a pain experience, okay? So if we could teach that athlete to move pain-free as soon as possible, then that's very useful for us. So what I like to do in this scenario is teach the person, if they've come in, and even in the clinical scenarios where someone's come in and go, oh, my back's went, can you see me today? And it's very acute. We're going to be struggling to decrease that protective tone because the system isn't ready to let go yet, okay? But what I find very useful and what we can do in this scenario is we can teach them how to get up and down off the floor pain-free, okay? Maybe to utilize strategies that doesn't put excessive forces on that lumbar spine, okay? So Pete, what we're going to do is we're going to show you how to get up and down off the floor, okay? So what I would do, it's almost like a bit like a kind of Turk get up style variation, but what we're going to do, Pete, is if you want to get up and down off the floor here, okay, or you want to get in and out of bed, what we're going to have to do is we're going to have to roll, okay? So when you move, Pete, I want you to exhale for a couple of seconds, give that diaphragm a chance to lengthen and the ribs to depress, and then we utilize the movement, okay? So what a lot of people are going to do is they're going to hold their breath when they try to move, okay? So Pete's going to go, and then he's going to try to move. So what we want to do is we want to encourage normal motions, okay? We want to restore the ability to breathe through movement again, through relaxed movement. So Pete, I want you to inhale, I want you to exhale for about 5 seconds. And as he exhales, we're going to see that rib cage start to depress. Keep exhaling, keep exhaling, keep exhaling, keep exhaling, keep exhaling. Good. So as that ribcage starts to depress, then the abdominals are going to be in a much better length-tension relationship. Whereas if he inhales, all the abdominals are long, they're going to find it hard to maybe contract as efficiently as they could do. Okay, so Pete, when you exhale for a couple of seconds, then we're going to initiate the movement through the last 3 seconds of the exhalation, for instance. Okay, so we're always going to move on an exhalation, okay, to help the abdominals function again, okay? Because remember, those extensors are probably clamped on. They're doing all the work traditionally from what I see clinically. So we want to encourage now the abdominals to work as good as they can. So if they can start to work a little bit, then hopefully that might reassure the system to let go of this protective tone around the lumbar extensors, which clinically I usually see in sport. So Pete, what we're going to do is we need to get you onto your front first, because if you try to do a sit-up, your back's not going to like that at the moment probably. Okay, so what we're going to do is I want you to roll and reach with this right hand across your body, okay? Or you can use this leg as well. So as you reach, now we need to get you onto your front and onto all fours. So as you reach, Pete, I want you to exhale for 2 seconds. And then on the 3rd, 4th, 5th second, you're gonna reach and we're gonna roll you over onto all fours, okay? So exhale, and then I want you to reach, and then pause there, Pete. Okay, so you can go onto your front here. Now from this position, Pete, we're gonna do a press up, okay? So we're just gonna press up on with your knees and your hands as you exhale, okay? So inhale, exhale for 2 seconds, and then exhale, I want you to press up into all fours. Okay, good. And then you're back into that position there, okay? So now we're here, okay? Now, depending on the strategy, Pete went into a little bit of extension there. You know, in real life, when someone's got a very acute injury, they may vary that strategy a little bit, okay? They'll probably move a little bit slower. So from here now, Pete, what we want to do is we want you to rock back, okay? So your heels go to your bum. So exhale, and I just want you to bring your bum to your heel so you can just rock those hands back. That's it. Now they're going to be moving in a very guarded position here. So as you get back, you're going to move your hands up into your legs. That's it. No, good, perfect. So what I like to do then is I like to pinch the skin here. So if Pete's kind of neutral, so if you stay there, I'll be able to get hold of the skin here, okay? Whereas if Pete's flexed, I'll lose the grip, okay? So if you come up into neutral, Pete, that's usually going to relax the skin a little bit. So now I can grip the skin. So I usually tell the patient that. So just grab a bit of skin there and you'll know then that your back isn't really doing a lot of work if you can grab the skin. Perfect. Now if you bend forward, you see you lose that grip. So you're just going to lose it a little bit. So it just helps them keep the back stable. And then what I want you to do, Pete, is I want you to push your hips through without losing that grip of skin. So just push your hips through to here. Perfect. So now we're on to tall kneeling, so to speak. And even these movements, you can give these as exercises to teach them to move again. Now what we're going to do, keep that skin there, Pete, and I want this left foot to come forward. So you're into a half kind of kneeling type, lungy type movement. Good, perfect. So again, if he has hold of that skin, that back isn't doing excessive motion. So he's pretty good. Now put that foot flat, Pete. Now here's the big thing, a bit more forward, is I want you to push up and I want you to push through the midfoot for me. So as you come up, push up, and then he's up onto his feet, okay? Now what we're gonna do is we're just gonna reverse that again. So Pete, reverse engineer it, so reverse lunge. Okay, good. Now get back into tall kneeling, so to speak. Then drop down into your heels. That's it, perfect. And the back hasn't done much work here. Now walk your hands into all fours for me. That's it, perfect. Good. Okay, good. And then from here, then we can start to get into, we can start to go into prone. So Pete, just start reaching one leg back, and then that's it. And just slowly lower yourself to the floor. Okay, good. And then exhale, good. Okay, so you're using a little bit of extension there, and then we'll just reverse it again. So Pete, with your right hand, reach to me. Yeah, and then you can reach that leg as well if you want, or you can do it that way. And then we're back onto the floor again. So that position there, this bit's a little bit hard with the rolling. So sometimes he might need to lift this leg and he might need to come across, okay, as he reaches. But particularly getting onto all fours. So if you just go onto all fours and working in those kind of positions, okay, so even the rock back, so he's just going to go forward and back. So he's just going to do some rock backs here as he's breathing. Then he goes into tall kneeling. So start to roll back, Pete, onto your heels, and then grabbing the skin and then working up and down there. So he might do 5 or 6 reps there. Then he might go into the lunge. He might get up and down 5 or 6 times. So those kind of sequences, just doing 5 or 6 reps of all those during the night, it actually helps him to recruit these muscles again, restore, reassure the system, okay? So I love that little kind of thing there. It's like there's rolling patterns, there's rock backs, there's hip hinges, there's lunges. You know, there's so much stuff there going on that we're reassuring the system that it's safe to utilize and generate torque through these key muscles again. So the sooner this nervous system goes, okay, it's safe to generate torque through these muscles, usually that means then that protective tone isn't going to have to work as much, because everything else hopefully then will start to do its job, okay? So that's the way I would go about getting a patient up and down off the floor. Very, very useful. And as I said, it's something that I would encourage you to teach the patient, if nothing else, on that first session when they come in. And you know, there's quite a bit going on, and you know, probably hands-on treatment isn't going to touch it at this point because it's so acute. So there you have it. Again, the key things: go slow, use the breath, get the ribcage moving through the breath, use the midfoot, squash an orange, get everything doing its job. You'll be amazed at how quickly we can decrease that pain experience. Well, if you enjoyed this content, you want more of it, head over to my website, thegotophysio.com. I've got loads of content there waiting for you to help you differentiate yourself from other therapists. With that said, in the next episode, I'm going to show you some very simple stretching techniques that you may or may not be using with patients that can give long-lasting relief. I'll see you in the next episode.